A little bit behind schedule as it is. My name is Tom Williams. I'm standing in for the chair who is published in the programme, who could not be here and sends his apologies. But I'm very happy to be here in a session which is about water safety plans, which is a subject dear to my heart. For those of you who are not familiar with water safety plans, I'm sure the next presentations will enlighten you. But fundamentally what we're talking about here is drinking water quality management. And we have four excellent presentations to take you through the next 90 minutes. What we will do is allow each of the speakers to have 15 minutes to present, and then we will have an opportunity at the end of the last presentation for some discussion if you have some questions and answers. So we will go through all of the presentations, and then we will have an opportunity to ask the speakers some questions. So without further ado, I would like to introduce our first speaker, who is Susan Kalani from the Water Authority of Jordan. I've known Susan for a number of years now, working on water safety plans. And Susan is going to present water safety plans, the roadmap for planning to implementation. Susan, do you want to come up to the podium?
Good morning, and thank you, Tom. You've been also one of the advocates of water safety plan that since we work together with each other. Okay, so since 2006, we have tried to introduce the water safety plan as a framework for the management of the water quality in Jordan. The WHO guidelines, since the 2004, they stress on that kind of framework in order to move from the reactive to the preventative water quality management. I'm trying now to go through the way that we have in Jordan traveled from planning till now we are in the implementation phase, and what are the enablers to create an environment so as to work within that framework. I'll talk a bit about our laboratories in the laboratories and quality department of WAJ. We receive that number of samples per year, and we do around 100,000 tests. Is that good? Does that ensure that the water quality is always safe to the customers? We have the compliance rates here. We have above 99.3 and going up to 99.7 last year, and we are around all the time, we are around this kind of percentage. What does that tell us? Is it safe? Do we guarantee that no incidents are occurring or any kind of crisis even related to water quality where some casualties might go to the hospitals? We know that we have many pathogens present in the water that might be resistant to the chlorine. What we measure, what we do test is the E. coli, which is the indicator for pollution. But what might be within that pollution coming in that we could not test and that might pose a risk? So we have a list of those viruses and protozoa that might be present but cannot be tested, and they might be also resistant to chlorination. So, over-reliance of the end product testing, or until we wait until the test result is coming, is very dangerous. And we, in between, since we sample and until we get the final result, sometimes 18 hours will elapse. What if this water was contaminated then, and people would consume that amount of water? Between the time of testing and the sampling, there is a certain time where we have a risk that people might ingest water that is polluted. And in many of the outbreaks reported in the world was in the absence of the fecal indicators. And there is a limited early warning capability of microbial testing. Water is distributed and drunk. But then later the results will be gained. water volume tested are rarely statistically representative. Yani we might have this sample, there's absence of indicators, and another sample at the same time will have indicators, and limited capability to detect short-term fluctuations. Then there's a confidence gap, and sometimes too little, too late. The framework for this water safety plan and the evolution of approaches that were adopted or issued by the WHO, let's say, that we need holistic and proactive approach, move away from over-reliance on end product testing, more emphasis on prevention, more focus on input monitoring, and more focus on process control. What we might introduce here as a different approach than what we used for is that we have the multi-barrier approach principle. For a water treatment, for example, we have multi-barriers. If a barrier fails, the other barriers will take care. It's rather too dangerous, for example, to have a certain water, a raw water, that is classified too, according to the classification of the water of E. coli content. For example, if it has more than 50 E. coli per meat mil, and then we said only we will disinfect by chlorine and send it to the people. This is rather too dangerous. We need another barrier. We need another treatment. And also, again, we look at the cost at the same time. We don't have to do thousands of tests, very specific tests, while we can have indicators that we can rely on. And the water safety plan would call also for monitoring control or control measures that can tell you that the system is good without trying to go into many tests that are so specific to ensure that your system is safe. So you have also to look at the cost factor here. Those are the guidelines of the WHO that provide the reference for all the countries in developing their own water safety plan framework in their countries. And this is generally the framework where we have the health-based targets that are set by the national regulatory body, which is the Ministry of Health. Let's say in Jordan, it is the board, the health board, which is chaired by the Minister of Health. And where we have the water safety plan, which is the responsibility of the water operator. And in that case, we call about Water Authority of Jordan and its companies. And then again, we will have an independent surveillance, which is another layer on top of the operator, which is again for the Ministry of Health here. Where in the health-based targets, we are saying that we have targets for the health that are set by the Ministry of Health, and that is translated into different water quality standards, where this health risk is implied in the water standard. We might have specific technologies. For example, as we said, if we have a type 2 water, it's not only sufficient to have chlorination, you have to go to another barrier, which is treatment, like in Zay treatment plant, for example. Or, for example, if you have a third class of water where the E. coli is present, is even like 5,000, then you will have to have another barriers like UV and sophisticated treatment. When we come to the safety plan, again, we are talking about the multi-barrier approach, about the preventative approach, and that is called, given the terminology of water safety plans. Independent surveillance, where the surveillance authorities will verify if the water safety plan as a process is working well, and to have an audit of the water safety plan. So health authorities in Jordan can go to any step of the supply system, and they can make their audits, and also they can make their final verification check on the end quality. We have many supporting tools also available that can help us in adopting this kind of water safety plan that were developed either by the IWA or the WHO itself, or even some of the manuals and training materials developed in each country like we have in Jordan. So why? Why do we want to apply the water safety plans? It would ensure compliance with standards and regulations along the water supply chain, yet controlling the incidents related to the water. Yani it's good to have a high compliance rate, but also we should aim also to minimize the incidents that are related to water quality. Assess the extent of risk assessment and management on public health. Ensure that the quality of services, and that is another task for the health authorities to look at the accessibility, affordability, continuity of supply, quality of supply, quantity of water. They have to measure it and to know that there are continual improvement in those measurements. Address customer and consumer needs and anticipations. Also to address the complaints as related to the water quality. Raising public awareness on water quality through awareness campaigns. We need in Jordan to regain public trust in the water delivered to them. Like last statistical analysis gave that 80% of the people of Jordan rely on bottled water, even in the Water Authority of Jordan itself. Increasing the level of data sharing among utilities, and that's another important issue. And of course, with that, there come a communication strategy. We will have to strengthen the regulatory activities also in Jordan, where this become a regulatory requirement. And cooperation among government agencies, because water safety plan is meant to be a tool that is to be shared by others. It's not only for the Water Authority of Jordan. It is shared. It has to have many stakeholders in the country, and also the research and development engines has to support the water quality management in each country. What kind of materials we have to use in the treatment? What kind of pipes we are allowed to be in contact with the drinking water supply? So we have also to have the R&D behind us. So we thought also with our partners from the IWA and from the WHO that the roadmap from planning to implementation starts from a vision to think big, yet to start small. Start with demonstration sites, develop the required legislative framework, build capacities, and move to scale up the approach to encounter all water supply systems in the country. And that's what we did in Jordan since 2006 until 2011, when we have altogether 6 demonstration sites adopting the water safety plan. And our this was introduced before, but it is the same that we have to in our step from the planning to implementation. We need to do initial sensitization, national steering group established from all encountered bodies, develop the regulations, a methodology for continual improvement and upgrade, multi-stakeholder consultation process, enabling environment where we should place all the enablers and the capacity building needed and the tools and the materials, training materials. Also, then we have to build the regulatory framework developed and implemented. This is the most important, where if it's found, we can easily move. And this is here where we started with the Wadi Sir in 2006. And then we had Wadi Al-Arab drinking water supply system, Zaid drinking water supply system, and that is the one that is now being implemented. It will be the showcase for Jordan from planning to implementation. Al-Karame Dam drinking water supply, and then we have Al-Aqaba and Al-Lajoon. So those are our pilots in Jordan. In our implementation, we have to define our existing tools, building blocks, and enablers to start. For example, in Jordan, we have certified operators. We have certified labs. We have also legislations and standards and guidelines that can support us. For example, and we have this guidelines for the raw water criteria, which defines that we have several kinds of water that need several barriers for treatment and for distribution. And I will talk about the legislations now coming with our supply chain. We have competent staff and we have tools. We have also supportive institutional arrangements. And I will come to that framework that we have developed for Jordan that is now adopted by the region through the WHO. And now I was in Lisbon it was October or November, and they have said that water safety plan concept has to be over the whole of the supply chain, yani from catchment to customer and from toilet to table. That means from the raw water until it is drinking water given to the customers, and then when we collect the water as a wastewater from the toilet, and when we reuse it and use for irrigation for agriculture. Because again, we need the safety of the people who are the receiver, the end users. And again, it is a collaborative approach where in Jordan we have WAJ, the utilities, the Ministry of Health, Ministry of Environment, Ministry of Interior, where we have severe pollution on the sources, and of course our customers and consumers and the stakeholders. And this is our supply chain that I always like to refer to. So we have the raw water here, where also we have the zoning. If anybody knew about Jordan's water resources planning, we have zones, where zone 1 is for WAJ to operate the own source, where no action is allowed. And we have many regulations for the raw water. When we want to use it for drinking, we have to take the approvals of the Ministry of Health. Then we have the collection system, preparation for drinking purposes, like for treatment or anything, transmission, distribution. And in the distribution part to the end customers is where our monitoring programs are targeted, because most of the risks are there. So if we want to move to risk management approach, we have to look where are the risks and to target our monitoring and our funds and our investment planning to where the risks are, and where the risks are having the priorities. For example, if they are type 1 or type 2 or type 3. Then we go to customer affairs and the customer satisfaction, and again when we measure those affordability, accessibility, continuity of supply, quality of the water, quantity delivered to them. Then we go to the wastewater supply until we reach the reuse or discharge, where we have another beneficiaries like farmers or end users, and then we reflect the water that was used, fresh water used for irrigation, as a fresh water that will feed again to the water supply system. So along this chain, we have many regulations in Jordan already there. So you can, for example, go from the guidelines for the water resources protection as a catchment management. We have also the MAU between Ministry of Health and Ministry of Water and Irrigation on drinking water quality monitoring related to water resource licensing for drinking purposes and handling. Of course, where we have verification of the blends of water, like DC water. DC water came with a certain content of radioactivity. In order to make it drinkable and compliant with the standards, we have to blend it. 2 minutes, okay, and so on. You can go to your flash drive and see all the regulations that are present in Jordan. The last ones that are dealing with the reuse, they are now under revision in Jordan, and they are taking into account the multi-barrier approach, where they are reliant on the WHO guideline for this multi-barrier approach and risk assessment. Voluntary or mandatory, we have to start on a voluntary incentive-based, and then we move until we build our regulatory system in the country, we make it mandatory. It should be then. We should go to mandatory. Why? Because it will give it a regulatory push. And for the Jordan, it has its own vision, and we are on the way. So on the way to achieve that vision, because we have our demonstration sites, we have the regulations in place now, we have the training in place, and we have the training materials in place. We have the stakeholders defined, we have the steering committee in the country, and we have also all the water utilities on board. They know what is water safety plan. We aim at within 7 years from our start in 2011 that we'll have all water supply systems in Jordan to have a water safety plan. And we have those kind of 2 laws that are very, very strong laws in Jordan. It is the National Public Health legislations and also the Ministry of Water and Irrigation law. I won't go to the details of who owns it, but usually the operator develops the water safety plan for each and every single water supply system within their authority. WAJ, our laboratories are the auditor, the first step auditor on that. We approve it as the regulator on the utilities in Jordan. But Ministry of Health has the final say of it if it's approved, and it will become a national working document. New jobs came into the bodies that are doing the surveillance. For example, Ministry of Health used to have only samples as an end verification step, and they did the sanitary inspection, but now they have to do the audit as well. This is then, I wanted to present that this is a good framework for all the national authorities in Jordan, how we are adopting the water safety plan, and that kind of setup is now taken to the region because it was a successful way we are working together. Yani Ministry of Water and Irrigation is working in a complementary way with the Ministry of Health, yet it is independent. They have an independent surveillance programs than us. So they are another an umbrella of the water quality management that might give confidence and trust by the people that their water is looked after by many agencies in the country. So not only one agency who produces the water and who does the water safety plan and approves the water safety plan. Ministry of Health is very important in the approval and in the surveillance part. Of course, we have many things that we have to adopt in Jordan in order to have it sustainable. We have the advocacy and dialogue, national one. We have the capacity building is very important. It has to continue from the top management to the middle management to the operators in their sites. And also the partnership and twinning, where we have, for example, in Zay, they are doing well. They can be like advisors to another utility in the country. Financial instruments also, because when we define risks in our supply system, we define control measures, and control measures sometimes needs financing. So we need also to find the financial instruments to support our adoption and implementation of the water safety plan. And that's it. Thank you.
Thank you very much, Susan. I think you provided an excellent scene setter for what water safety plans are about. And I think conceptually, there's three key things to remember here. So it's catchment to consumer. We're looking at that whole supply chain of drinking water quality, production and management. It's risk-based, so we're looking to identify and manage the risks. And it's preventative, doing that before it's too late. So traditional end-of-pipe monitoring is no longer sufficient in itself. We must be checking from catchment to consumer on what the risks are and preventing contamination before it's too late. So I think that really sets the scene very well, Susan, and thank you so much. Any questions for Susan? We'll take it at the end when we have all the speakers together and we can have a bit of a discussion. Okay, well, let's stay in Jordan for our second presentation from Nida Al-Dajawa, who is talking about identification of the sources of microbial pollution, fecal coliform and fecal streptococci of water. So, Nida, you will join us. Thank you.
Hi, I am Nida Falih Mustafa Daja from Water Authority of Jordan. I am researcher at I am working as a researcher at Water Authority of Jordan. I am holding a master in teaching science. I want to talk about my research is identification of microbial pollution, fecal coliform and fecal streptococci in Jordan water resources. A more desirable bacteriological indicator should not be able, the degree for water quality should not be to identify the degree of water pollution, but also can distinguish the source of pollution, whether from human or whether from warm-blooded animal feces, because the determination of the source of pollution is very important in assessment of water quality from the standpoint of public health. What are the fecal bacteria and why they are important? Fecal bacteria, there are two groups of bacteria, fecal coliform and fecal streptococci. They are indicator as a possible presence of possible sewage contamination in the water, because they are found in human feces and animal feces.